So we are looking at the differential. So let's quiz ourselves. I need someone to read this case for us, please. Somebody should read this case for us.
A 17-year-old female presents to the clinic with her mother, who is concerned about her daughter's significant weight loss over the past 6 months. The patient reports an intense fear of gaining weight and regularly skips meals, consumes very low-calorie foods, and exercises excessively. On examination, she's significantly underweight with a BMI of 16. She denies any episode of binge eating or purging behaviors. What is the most likely diagnosis? A, bulimia nervosa. B, anorexia nervosa. C, avoidant or restrictive food intake disorder, ARFID. D, major depression.
Okay. Now, doctor, I want you to tell me what is your answer, and you give me reasons why, right? You give me reasons why it is A and not B, or reasons why it is B and not C. Just, can you let me know why? What is your answer? Dr. Neka went for C. That is avoidance restrictive food intake disorder. Is that the correct answer? Doctor, what is your answer? What answer will you go for?
Am I supposed to?
Yes, please speak.
Okay,
What is your
so
answer?
my answer is B.
B.
Anorexia, yes, nervosa.
Okay, so why is it not bulimia nervosa? Why?
Yes, because she denies any episodes of binge eating or purging behaviors.
Okay. Why is it not avoidance restrictive food intake disorder?
Yes, because there's significant weight loss and there's intense fear of gaining weight.
Okay.
Yes. And she also exercises excessively as well.
But those are the positive things which speak for anorexia. But what are the things which speak against bulimia in the question? Something in the question stem speaks against bulimia. Who can
that's
help?
the binge eating and the purging.
Exactly. She denies any episodes of binge eating, right?
Yeah,
okay, good.
Yes.
So the answer is anorexia nervosa. This patient's intense fear of gaining weight, significant weight loss, and restrictive eating behaviors without binge eating or purging episodes are consistent with anorexia nervosa. Bulimia nervosa involves binge eating followed by compensatory behaviors, which this patient does not exhibit, right? Now, avoidant restrictive food intake disorder involves food restriction without concerns about weight or body shape. So you see the way we are pulling the differences? Anorexia nervosa, the patient is very concerned about their weight. They want to remain thin. Bulimia, they may keep their normal weight, but when they eat, they purge. Avoidant restrictive food intake disorder, it really does not have anything to do with the patient. It has to do with the specific food, and I'll explain why. And major depression typically does not present with such a focused concern on weight and body image. So many things can make somebody depressed. So doctors, these things, there's a science to preparing for the exam. There's always key things you need to look out for in a question stem, which will help you. So that, you don't go, bulimia nervosa and anorexia nervosa. I don't really know. No, there's a way you can tell. Right? Okay, next question. I want someone else to read this question for us.
Okay, doctor, I can read. A 22-year-old female college student reports recurrent episodes of eating large amounts of food in a short period, followed by feelings of guilt and self-induced vomiting.
Mm-hmm.
She maintains a normal weight for her height and expresses significant distress about her eating behaviors.
Beautiful.
What is the most likely diagnosis? Option A, bulimia nervosa.
Mm-hmm.
B, anorexia nervosa.
Mm-hmm.
C, avoidant restrictive food intake disorder.
Mm-hmm.
And it's D, obsessive compulsive disorder.
Okay, good. Now you can easily tell me your answer, right? What answer would you go for?
Yeah, doctor, I go with A, bulimia nervosa, because she's feelings of guilt and self-induced vomiting.
Beautiful. Now we are getting the concepts. So this patient's recurrent episodes of binge eating followed by compensatory behaviors such as self-induced vomiting are characteristic of bulimia nervosa. Anorexia nervosa would typically present with significant weight loss and restrictive eating without binging. Okay, and then the avoidant restrictive food intake disorder involves restrictive eating without weight concerns. So you see, Anorexia nervosa and avoidant restrictive food intake disorder both have restrictive eating, but anorexia nervosa has weight concerns. Avoidant restrictive food intake disorder does not have weight concerns. And OCD involves intrusive thoughts and repetitive behaviors not related to eating or body image. Doctors, please, is it coming home? Because I'm giving all these examples so that we can, even from a question stem alone, know what to do. Now, I'm going to read this question. A 14-year-old boy is brought to the pediatrician by his parents because of his extreme pickiness with food and recent weight loss. Okay, he avoids many foods due to their texture and fears choking when eating. His parents report that his eating habits are not influenced by concerns about his weight or body shape. His BMI is slightly below normal, and he has mild nutritional deficiencies. Now, with those clues I gave, what answer will you go for? A, bulimia nervosa. B, anorexia nervosa. C, avoidant restrictive food intake disorder. And D, major depression. It looks like now everybody is getting it. And that is the essence of the way we teach in MedCognito. You see, when I stack some questions one after the other, there's a reason. So that by the time that you finish answering those questions, the concept would have stuck. Because at first, many candidates will, oh, okay, avoidant restrictive food intake disorder, like we see it, but we don't know how to deal with it. It looks like now everybody is getting it. Avoidant restrictive. And this patient's avoidance of food due to texture and fear of choking without concerns about weight or body shape fits the criteria for avoidant restrictive food intake disorder, right? That is it. Bulimia nervosa and anorexia nervosa both involve concerns about weight and body image. Major depression could involve changes in appetite, but not specifically avoiding patterns such as seen in avoidant restrictive food intake disorder. Next question. A 20-year-old male presents with persistent low mood, lack of interest in previously enjoyable activities, fatigue, and significant weight loss over the past 3 months. He denies any concerns about his body weight or shape. He also has difficulty sleeping and reports feeling worthless. What is the most likely diagnosis? Don't forget that these sets of questions are to look at the various differential diagnoses of anorexia nervosa. So how do I pick bulimia from anorexia? How do I pick anorexia from avoidant restrictive food intake disorder? How do I pick avoidant restrictive food intake disorder from major depression? Now everybody is getting it. Dr. Mana says D. Everybody is saying D. You know why? Because you've gone through this systematically. You've gone through it systematically. And so the answer is major depression. The patient's persistent low mood, anhedonia, fatigue, weight loss, and feelings of worthlessness are indicative of major depression. So doctors, if you are sleeping now and Dr. Bruni wakes you up and says Dr. Rabah or Dr. Man or Dr. Khadija or Dr. Parag, just tell me the differences between these 4 conditions. A, anorexia nervosa. B, bulimia nervosa. C, avoidant restrictive food intake disorder. And D, major depression. And let's even add E, obsessive compulsive disorder. We'll be able to deal with it. Dr. Jane says you make it so easy. Dr. Kano says light appeared in the tunnel of abnormal weight loss. Exactly. Light, we always shine light on the topics. Dr. Farah says, loved your acid-base balance. Awesome. Okay. Next question. 25-year-old woman referred to a psychiatrist due to time-consuming rituals that interfere with her daily life. She spends hours each day washing her hands to prevent contamination, despite knowing her fears are irrational. Her behavior is not related to concerns about weight or eating. What is your answer? This one is free bono, pro bono. It's easy. It's easy. It's easy because now we've gone through everything. And the answer is D. The patient's time-consuming rituals and irrational fears of contamination are characteristic of obsessive-compulsive disorder. Simple.